Hi, Rob. We are very privileged to have Joe Avelino, a nurse executive and a hospital CEO. Um, Joe, thank you for, taking your time, accommodating us in spite of your busy schedule. I know you're very busy, but we're very privileged to have you today. So, Joe, can you tell us more about your accomplishments, please?
Oh, sure. So a little bit in my role as CEO, I've been a chief executive officer for close to almost 15 years now. At College Medical Center, it's been I opened up the place back in October 9th, 2013. We're licensed for 221 beds here at College Medical Center in Long Beach, California, in LA County. And a little bit about my background. My background as a nurse. I have, prior to my role as a chief executive officer, I have been a chief operating officer, chief nursing officer, as well as been in the regulatory world of quality and performance improvement. And along with that, have done neurosurgery, critical care, ED nurse, and currently, in my role as a executive, I'm also a this year elective chair for the Hospital Association of Southern California, and also a board of director member for the California Hospital Association, as well as the United Hospital Association, and also has served over 25 years in the military as a lieutenant colonel in the California Army National Guard.
Wow, very impressive, Joe. So, uh, you know, um, we're very privileged to have you, honestly. Okay, Joe, we're celebrating a Vein Week, and I've mentioned that. And I wanna know your perspective. If you can share with us your perspective on providing care as a total person, as a CEO and as a nurse executive.
From a total person perspective, I'd like to say, uh, for particularly focusing on acute care side, looking at the emergency department, particularly in the emergency department where our ER, the College Medical Center, we have approximately about 1,500 ER visits, or some people say encounters a month. On the behavioral health, over 500 admissions a month, of which 250 of those admissions come from the ER. In the acute care side, we have over close to 300 admissions a month. So you're looking at it from a perspective where we have the opportunity to obviously evaluate the physical and health status of the patient. And then the mental aspect of it, particularly looking the fact that we have a psychiatric evaluation team that has an opportunity to evaluate and assess the patient, and in some cases, if necessary, put them on a 5150 hold, of course, with College Medical Center having that LPS designation. The other buzzword you hear out there, Jennifer, is that the social determinants of health, where obviously you not only look at the physical aspect, where of course you can evaluate that from the ER, and then if the patient needs to be admitted on a med surge or telemetry or intensive care unit, we can do so accordingly. And then I also mentioned about the psychiatric behavioral health component, having a psychiatric evaluation team, but we also need to look at from a social determinants of health, the patient's social, cultural, environment situation, and also the person's education. And just keeping in mind, for example, in Long Beach, where we have a big homeless population, impoverished, most of our paramedics are either self-pay or the so-called no pay, or Medi-Cal. So looking at that social determinants of health, you have to factor all that in when you look at the whole total person concept.
Okay, Joe, that's fantastic. So very good, very well said. So, Joe, thank you very much. I cannot thank you enough, for sharing us your perspective on, providing care as a total person. So,
Thank you.
do you have anything else? Like, do you have a takeaway for our, viewers? Any takeaway that you can tell them?
I think what's really crucial is one of the top priorities out there in terms of our community here in Southern California is access to care. And obviously the ER is a crucial component to having that access, but there's also from a total person standpoint, when you look at chiropractor, for example, or FQHC for quality federally qualified healthcare clinics or urgent care centers, um, take a look at what is the access to care, which is important to look at to evaluate to manage the care of the total person, and even from outpatient psychiatry, what they call urgent or crisis stabilization units or urgent care centers where you're only seen there for 23 hours and 59 minutes, not necessarily needing the inpatient criteria for behavioral health, but just be cognizant of what are the resources out there in community with regard to access to manage the whole total person.
Thank you very much, Joe. That's so very insightful information that you gave us. So thank you very much, Rob. And we'll be talking soon about providing care as a total person. Thank you so much, Joe.